Hi there, everybody. Will Dupree here in the KXAN Live studio. We are going to carry a news briefing here shortly from the Texas Department of State Health Services talking about vaccine distribution and allocation. So let's take a listen.
On some occasions, she's our DSHS scientific advisor and vaccinologist, is on hand for any more technical questions you may have that may come up during our briefing. As a reminder, to ask a question on vaccination, please type it into the question box, include your outlet so we can recognize you appropriately. It doesn't automatically populate with what your outlet or your employer is, and we'll certainly get through as many questions as we can in the time we have allotted. The briefing is being recorded. We'll send a link once it's posted and available. It's usually an hour or two after we conclude things here. Commissioner Garcia will have some opening remarks in a moment. First, though, I wanted to say a word about public health precautions as we continue to fight the pandemic. As the governor made clear on Tuesday, COVID-19 is still with us. People should continue to take personal action to help reduce the spread of COVID-19. Our public health recommendations include that everyone should maintain social distance, wear a mask when you're around people you don't live with, wash your hands frequently, stay home when you can. We know these protective actions slow the spread of COVID-19 among the individuals taking them, among their friends and their family and their community. They help contain the disease, keep cases low, and reduce the chance that new, more dangerous variants will appear. All Texans should keep up the good work they've been doing to slow the spread, and more people are vaccinated. With that, back to the topic at hand, vaccination. Commissioner Garcia, what can you get us? What can you let us know about vaccination right now?
Good morning, everyone. It's good to be with you all today. So let's just dive right into the numbers. As we were expecting and hoping, our providers have really bounced back in the last week and a half since the weather cleared and vaccine has started to arrive again. And since we last spoke, we've passed through two milestones, 5 million and 6 million doses administered, for a total now of 6.1 million doses administered all across the state. Now, when we break that down, that's 3.9 million who have gotten at least one dose, and 2.1 million people are now fully vaccinated. And providers have provided reports of over 200,000 doses administered in the last 3 days. So they continue to do exceptionally well. I'm also very pleased with the progress that we continue to see in vaccinating our community 65 years and older. And we're closing in on half of that critical population, with 46% of people 65 years and older getting at least their first dose. More than a quarter of all seniors are now fully vaccinated. And when we're looking at the broader population, more than 1 in 6 Texans 16 and up have gotten at least one dose. That's all really good news. Now, looking toward next week, we have some big numbers coming in, and we're expecting to receive more than 1 million first doses of vaccine here in Texas. That's more than 900,000 doses allocated by the state to our enrolled providers and the federally supported sites in Houston and North Texas. Those doses will go to more than 1,600 individual providers, and that's hundreds more than what we've been able to provide vaccine to in a single week, more than ever before. Plus, there will be over 200,000 doses directly allocated to retail pharmacies and federally qualified health centers here in Texas through the federal government. And I know we haven't talked a lot about those FQHCs, but as primary care providers who serve people regardless of their ability to pay, they really play a critical role in vaccinating people who would otherwise have difficulty accessing health care. Now, the federal government is now providing vaccine directly to some FQHCs here in Texas, but even before the federal program, FQHCs, community health centers, and rural health clinics have been a vital part of our vaccine distribution plan. We've allocated vaccine to over 400 of them across the state, and more than 80% of them is enrolled as vaccine providers. Now, more will be getting even more vaccine this next week, both through federal and state allocation. In other news, many of you know that we now have a new toolkit, new tool in our toolkit here, and that's the Johnson & Johnson vaccine that was recently authorized by the Food and Drug Administration over the weekend. And just yesterday, we saw the first few shipments arrive here in Texas, with 24,000 doses being divided among the 3 federally supported sites. They'll get those again next week, and we will be able to allocate nearly 220,000 doses of Johnson & Johnson in the coming week. Now, this is a big step in us boosting the ongoing supply, but it is a little uncertain right now what the distribution of the Johnson & Johnson vaccine will look like the week after next. We are currently awaiting more information from our federal partners, but this week's agreement that Merck will help manufacture the vaccine is going to really help ramp up supply. So the last and final big other piece of news that I wanted to share is the direction that we received from the federal government to add school and daycare staff to the list of people eligible to be vaccinated. And as you may have already seen, we notified providers of that yesterday. And so as of now, teachers and other school and daycare workers are eligible to receive the COVID-19 vaccine. Now, we have the definition that's given to us by the U.S. Health and Human Services as those who work in pre-primary, primary, and secondary schools, as well as Head Start and Early Head Start programs. Now, this includes the teachers, staff, bus drivers, and other staff that are in those environments, and those who work as or for licensed child care providers, including those center-based and family care providers. Now, to be clear, that doesn't mean that they're jumping past other people in line. We want providers to keep vaccinating everyone in 1A and 1B priority groups, but providers should now be including them as they administer vaccines. And I expect that there will be multiple pathways that teachers and other education staff will be able to get vaccinated. Some will take advantage of the existing providers like hub locations and pharmacies. We will be allocating vaccines to those school districts that have enrolled as vaccine providers. And I expect that some providers will partner with school districts to vaccinate their employees. Overall, we'll have more information about our targeted vaccination efforts for school workers soon. And Chris, I'm happy to take any questions on any of these or other vaccine-related topics.
Thank you very much. With that, we will open it up to questions. The first one from Hadi Mawadi with KERA in Dallas. Can you reiterate the state's rules surrounding the need to provide identification at a vaccination site? Are certain documents required? Are foreign passports or out-of-state driver's licenses acceptable?
So we do ask that you have some sort of identification. However, at the end of the day, if you present and you don't have it on you, we want you to be vaccinated. Just as a reminder, U.S. citizenship is not a requirement for eligibility for the COVID-19 vaccine.
Jessica Shorten with the Montgomery County Gazette asks, what percentage of Texans should be vaccinated before DSHS would feel a degree of herd immunity has been achieved?
So the science is still evolving around herd immunity, and the range varies depending on what source you look at. And so right now, we're not willing to put an exact number on that, but I can tell you that the conversations are ongoing with all of our scientific experts based on the latest literature reviews.
And William Joy with WFAA in Dallas. What's the threshold for moving to 1C, or at least sharing the group details, and what impact did the move to include teachers have on that?
So obviously, with the move of adding teachers and child care workers, that does add new people to our eligible population to be receiving vaccine. The definition for 1C should be coming to you all soon. Based on our projections for increased supply coming this month, we do expect at some point this month that we'll be able to make an announcement on 1C.
Moving on, Brad Stryker at KView asks, data shows about 1,400 wasted doses from outages caused by the winter storm. Can we expect that number to go up as more reports come in?
So there might be a few that just still trickle in past this initial week. However, I think that the majority of them have already been reported, given that this is the immediate week coming off the storm. And so I think for now, it's probably the majority of them due to the storm.
Sorry, just scrolling down here, David Littman with KYTX up in the Tyler area. What's allowing the state to distribute to so many more providers next week compared to before?
So it's the more vaccine is being allocated to us. So with the Johnson & Johnson vaccine, we will have about 220,000 more doses coming in to our state allocation. And so that helps us have much more widespread across all of our providers.
And from Rudy Morales at KRGV in the Valley, he says, good morning. What, if any, discussions have taken place regarding more FEMA sites around the state?
So at this point, conversations are ongoing with FEMA. What they have told us is that they would be willing to have conversations about potentially moving the FEMA sites depending on demand, and whether or not the existing ones would continue. So it's unclear right now what the final ruling will that be, but we are having conversations with them.
Thanks, Rudy, for that question. Garrett Berger in San Antonio asks, at KSAT, there has been some debate in San Antonio on whether to have a vaccine registry. The mass sites currently are first come, first serve for all of them. And sorry, I just lost the question. There we go. For every new round of shipment, does the state have a recommendation one way or the other on how to manage those lists and sites locally?
So one of the best practices that has evolved throughout the COVID-19 vaccination effort is for counties and communities to agree to use one wait list, and then to be able to pull from that consistently. Now, communities across the state, some of them are choosing to do that, some of them are opting not to do that. However, at the end of the day, that is up to the local leadership on the ground to make those decisions.
Got it. Let me move down a little bit here. Looking for the next, there we go. Aparna Zalani at KDVT in Dallas asked, when will schools who are registered as providers get the doses, and what guidance are we providing to those schools?
So the same guidance goes to all of our COVID-19 vaccine providers, that whatever is provided to them that they need to use it within that same week, they are required to report timely, and the storage and handling needs to be properly administered. We will expect to see additional schools getting direct allocations in the coming weeks, particularly as vaccine supply continues to increase.
William Joy at WFAA in Dallas with an additional question. What does the state assess how equitably vaccines are distributed across socioeconomic status? And if so, how well is Texas doing so far?
So we look at a variety of different things when we are looking at distribution for vaccine. And again, if you guys recall those maps that we used to show, allocation doesn't necessarily always lead to vaccine administration within those. And so we continue to look at the data and see what the data is telling us, and use that data to help evolve week to week to make sure that we're continuing to do better about not only where we're putting the vaccine, but also in talking with our providers to make sure that they're doing enough outreach and education on the ground with their local communities to get those people comfortable to come in and be vaccinated. Jessica
Shorten asks, considering the Janssen vaccine can be refrigerated and does not require the ultra-cold storage of Pfizer and Moderna, will it be directed to more rural areas of Texas?
So you'll notice in the coming week, we have Johnson & Johnson going all across the state. Obviously, the storage and handling component and the ease of just one dose is something that is very attractive to the majority of our providers all across the state, and so it will be widely dispersed.
And part of Jessica's question was talking about that ultra-cold storage. Dr. Rye, I want to bring you in for a moment because I know we've had an update on the Pfizer storage and handling from the FDA in the last week or so, and wonder if you might be able to just provide an update for folks on kind of what that looks like and what the changes are.
Thank you, Chris. Yes, so Pfizer recently was approved to update its storage and handling of its vaccine. And the specific changes that have happened, if you recall, Pfizer's vaccine had two different temperature conditions they could be stored. One is the ultra-low temperature, where it's stable for six months. And then the second was that it can be under standard refrigerator conditions, where it's good for 5 days or specifically 120 hours. With the recent changes that happened on Thursday, the additional storage and handling is that the vaccine, Pfizer's vaccine, can be stored under standard frozen conditions for 2 weeks. So that allows greater flexibility of those who may not have ultra-low temperature can store it in regular frozen conditions for 2 weeks, then take it out perhaps when they're ready to use it and put it in the regular refrigerator for 5 days.
Thank you very much. Moving on to the next question, Garrett Berger at KSAT in San Antonio once again asking that local officials in San Antonio and Bexar County say they can handle more vaccines. Will more be coming our way?
So more vaccines are coming. As the vaccine supply continues to ramp up, we will increase the amounts going to everybody.
William Joy at WFA in Dallas that says that Dallas and Tarrant County officials still say the state is not providing a fair number of doses. Are there any discussions to change that?
So as you all know, one of our guiding principles from the expert vaccine allocation panel is geographic diversity and equity across our entire state. And so we will continue to look at the data on a week-by-week basis and see where every county is in order to make sure that everyone's getting an equitable distribution.
And I did just to add a little bit more to that, did look at the numbers just before we were coming in, and through the current week's allocation, both counties continue to receive more vaccine than their percentage of the population would show. So Dallas County has about 9.05% of the state's 18 and older population, and has received 9.69% of the state allocated doses to this point, and that includes those doses going to the federally supported sites. For Tarrant County has 7.20% of the 18-plus population, and that compares with 7.56% of the doses allocated. So as you can see by those numbers, those counties are each continue to receive a bit higher than average share of the vaccine being allocated through the state up to this point in the response. Moving on, up to Marfa now. Mitchell Borden at Marfa Public Radio asks, as more people qualify to get the vaccine, are there any talks or plans to send the Texas National Guard to hold large vaccination clinics in rural communities?
So you may recall that the governor announced the Save Our Seniors initiative just a week or so ago, and the Texas Military Department is deploying teams all across the state to particularly rural areas where they have lower uptake within the population 65 and older. Conversations are ongoing about how we would further expand their use, and particularly in light of the new population added with the education and child care workers. But the details of that are still unknown right now.
Farah Zalani in Dallas asks, are vaccines mandatory? Can teachers refuse to be vaccinated?
So everyone that gets the COVID-19 vaccine, it is their choice. By the fact that this is an emergency use authorization, the COVID-19 vaccine cannot be required. So teachers absolutely can choose whether or not they want to be vaccinated.
A question from Vanya Patino in Amarillo. She asks, when do you expect the Johnson & Johnson vaccine to be widely available, or at least sent to providers across the state instead of just the FEMA locations?
So that will be next week. The Johnson & Johnson should start arriving Monday of next week.
And a question from Rachel Bowman. How does DSHS plan to deal with potential misgivings about getting the Johnson & Johnson vaccine?
So you may have heard our commissioner speak about this in other venues, but getting Texans vaccinated as quickly as we can is really, really important. And so the first opportunity that you have to be vaccinated, you should jump at that, regardless of what brand that is available. And so we really want to encourage that the vaccine is safe and effective for all folks, and every single one of the vaccines that we're putting out is effective. We want you to get vaccinated as soon as you can.
Time for a few more questions. Andrew Bell with the Texarkana Gazette asks, was the influx of doses from Johnson & Johnson a determining factor in making doses available for teachers?
No, the Johnson & Johnson allocation actually came to us well in advance of the federal directive.
Clayton Neville asks, this is with WVAP, is the best recommendation for teachers who want to be vaccinated to sign up on local or pharmacy registration lists, or will there be a different venue for those educators?
So the specific details on how we're going to roll all of this out are still under development. You know, we just announced this yesterday. But there's a variety of ways. So by all means, they can immediately go and sign up with one of the hubs or other provider sites. With a retail pharmacy program out there, there are doses that are out there across the state in different retail pharmacies. They are eligible to receive the COVID-19 vaccine there. Where they may have a community vaccinator close to them, you know, they could reach out to that vaccinator and start talking to them about partnering to bring vaccine on site to their campus as well. So there's a wide variety of ways that they could go about it, and we'll be structuring more of that in the coming days, and we'll be able to provide more guidance on that soon.
Question for Molly Smith in El Paso with El Paso Matters. What are the rules regarding whether a hub provider can allocate any of its weekly doses to another state-approved provider, such as a community health clinic? I know we've seen these kinds of partnerships crop up in various parts of the state.
No, absolutely. And so that is another one of the best practices that has developed over time with our vaccination efforts. And we see a lot of our hub providers that may carve off pieces of their allocation and transfer it to another approved COVID-19 provider in order to help get targeted populations vaccinated in a more timely way.
Ashley Wild at KXAN in Austin, I think it's David Travis, asks, many other states opted to follow the CDC ACIP guidelines to include other essential workers in earlier phases like 1B. Can you talk to discuss why Texas experts opted to wait on that population?
Absolutely. So one of our guiding principles as an expert panel has been using data to help drive those conversations and decisions. And when we looked at the data and when we looked about both cases and at deaths, overwhelmingly, those that are more severely impacted, and when I say that, I mean those that are hospitalized and those that have the most severe outcome of death, are in our 65 years and older, and in individuals that have comorbidities that put them at greater risk for those severe outcomes. And so at the end of the day, we followed the data, and the data is where we landed with our 1B population.
Ashley Lopez at KUT in Austin asks, about a quarter of DSHS's demographic data related to who's been vaccinated is still listed as unknown race. I know DSHS has made updates in the data entry process to improve things, but what else could be hindering the state's ability to get good data?
So that 25%, while it's still relatively large, that is a historical component of the data. When you look at the data since the technical change in MTRAC, the missing data is now only about 4% of what comes in on a weekly basis. And so we'll see that continue to decline over time as more and more data gets entered because that's just older data that's sitting there now.
Ruben Villarreal with KGNS in Laredo asks if there are any plans to allocate vaccines directly to TEA or to school districts.
So some school districts have already signed up as a vaccine provider, and we will be allocating to them. Conversations are ongoing with our sister agency over at TEA, and once we have some more information on future vaccination plans, we'll be able to share that with you all.
Coming to the end of our time, a couple of questions that kind of go together. Let me ask them together, Imelda. Kayla Harris with the Houston Chronicle says Texas has one of the lowest rates of vaccine administration per capita in the nation. What factors may contribute to that rate, and how can officials ramp up vaccinations? And Zach Hedrick with News 4 in San Antonio asks, what other actions can DSHS try to take to get more vaccine doses allocated from the federal government to the state and to state of Texas in the coming weeks?
So by far, the way that we get more doses administered is by getting more vaccine supplied to Texas. When we look at the amount of vaccine on any given time, it ranges from 80 to over 90% doses administered at any particular point in time. So the way that we get more Texans vaccinated is by increasing our supply. And we have had multiple conversations. We continue to engage our legislative and elected congressional leaders in order to make the argument for Texas to get more doses. We know that CDC is using older data that has us with a lower adult population than what is currently estimated now. And so we have shared that information. They have heard us. We have yet to actually see them make a change from using 2018 to 2019 census data. However, please know that we continue to have the same conversations. There has been some turnover at the federal level, and so we need to repeat some of those conversations again, and those continue to happen. And we are fighting every day to make sure that we can increase supply to Texas.
Thank you very much, and thanks everybody for being with us today. Really appreciate your attention, appreciate your questions, thanks for as always for helping us get the word out about how people can be vaccinated in Texas as we continue to see those sites expand across the state. As Imelda mentioned, 1,600 plus providers will be getting vaccine next week, and we will certainly take it from there. That'll be, as she mentioned, many more, hundreds more than have received vaccine in a single week previously. So once again, thank you for being with us. Thanks for your excellent questions. Thanks for helping us get information out that's helping prevent the disease in Texas and help saving lives across the state. Have a good rest of your week.
Hey there, everybody. Will Dupree once again in the KXAN live studio. Thank you all for sticking with us. Quite a bit to share from this update. The latest numbers about vaccine allocation and distribution from the Texas Department of State Health Services. Just pulling up my notes one more time to just be able to share what they talked about a few moments ago. So first up, Imelda Garcia, who is an associate commissioner for DSHS, shared two big milestones. One being that the state has now administered 5 million and 6 million doses total so far, and that in the last 3 days, 200,000 doses of COVID-19 vaccines have been administered in the state. She also said that at least at this point, 1 in 6 Texans who are 16 years of age and older have gotten at least 1 dose of the vaccine. The other big numbers she shared just a moment ago is that the state is set to receive more than 1 million first doses of the COVID-19 vaccines, and those are going to allow allocations to be distributed to more providers. Now at least 1,600 providers will receive doses of the shots. She also discussed two other big things that have happened as of late. The fact that the Johnson & Johnson vaccine has gotten that emergency use authorization that happened just this past weekend, and already the state has received 24,000 doses. Those have gone directly to the mass vaccination clinics run by FEMA, and those are in Houston, Arlington, and Dallas. She says that they are expected to get more doses shipped in this next week, and that will increase the whole allocation statewide by more than 220,000 doses. The other big point is that yesterday, Texas DSHS is now saying that teachers and school workers and daycare staff members are eligible to receive the vaccine as part of the 1B group. That came as a directive from the federal government, and now the state is implementing that too. They're encouraging teachers and other school staff members to go on to those hubs and other providers and even some of the retail pharmacies that have COVID-19 vaccines to try to get their shots at this time. I know that had been a big point of contention, hoping that teachers would be brought up on the list in the state, and now they have. Additionally, if people are wondering about that 1C category, so this is trying to expand who is available and eligible to get the vaccine. They are expecting sometime this month, so sometime in March, the state will define who is in 1C and when those people in that group can get their vaccines. So of course we will keep asking about that and try to provide the latest information as soon as we have it available. As we are talking about vaccine distribution and allocation once again here in the state, we have to point out that today, March 4th, marks 1 year since Texas reported its very first case of COVID-19. We made this graphic just to mark this big designation. It's hard to believe almost that today marks 1 year since the first case of COVID-19 popped up in the state, because right now we have seen more than 2 million cases, and that number continues to climb. Just for a little added extra context here, again, the first Texan who tested positive was reported today a year ago, and we have now lost more than 43,000 people from the virus. Obviously, a glimmer of hope exists in that more than 9% of the population is fully vaccinated. That equals about 2.1 million Texans. And we are expecting even more vaccine distribution in the week ahead, as the state expects about 1 million doses divvied up here in the state next week. We thank you all again for joining us here on KXAN Live. I'm Will Dupree. We will continue to provide updates about this situation and where the vaccines go from here. So, of course, you can stay with us on KXAN.com and the KXAN News mobile app. Everybody, take care, stay safe. We will see you back here another time. Enjoy the rest of your day.